All right, so welcome to our Cooperative Care Knowledge Nibble, everyone. I am going to keep this short and pass it right over to Rachel so she can walk you through everything cooperative care to make procedures and grooming and everything that the dogs need to have done more positive and comfortable for them. Rachel, the floor is yours.
Thanks, Emma. Happy Sunday morning. Hope everyone's having a good weekend. Sorry about my voice. My child is sick, so now I am sick. The joys of having a toddler. I'm going to be sharing my screen, so if you guys have any questions, please you can just raise your hand or go off mute and just start talking, and I can answer your questions. If not, you can just hold them till the end, and we will leave a little bit of time for any further questions that anybody has. All right. Can everybody see this?
Yep, you're all good.
Yeah. Okay, perfect. All right. So today's knowledge nibble, like Emma mentioned, is all about cooperative care. So for us, this is a really important topic, subject that we really want to implement when we start it kind of right from day one. Once the puppies are born, we really try to make handling a positive experience for our puppies. So that, right from the beginning, they're knowing that this is something that they're going to get rewarded for. It is something that they can have a positive association with. So hopefully, as they move through different stages in their life, they continue to see it as a positive experience and not something to be fearful of. So what is cooperative care? So cooperative care is basically allowing the learner to be an active participant. This means that they're allowed to say no to things that they may be uncomfortable with during vet care, grooming, kind of through any procedure that they might find uncomfortable. So how do we go about teaching cooperative care? So really, just like any other skill, it's about patience and lots of practice and lots of food rewards. Like I just mentioned, it is a skill. So just like you would teach a sit or down, the more you practice, the easier it's going to be. That's the same with any sort of cooperative care. Another aspect of this is working on some duration behaviors. So really what we're looking for when we're doing cooperative care is we want our learners to be kind of standing, or it can be any position. So sit down, stand, chin rest, but we want them to be able to hold the position so that they can be still. And that just makes any procedure that humans need to do a little bit easier. This also gives the learners the opportunity to say no. So if they're in a stand position, and we're just doing some general body handling and they choose to walk away, that's them saying no. That's us going, okay, our dogs need a break. Let's give them a little bit of a break. Once they return to us, we can start the procedure again. So when can we use cooperative care? So the possibilities are endless. There's all kinds of different things that we can use cooperative care with. But what we are going to be covering today is nail trims, which is probably our most common cooperative care technique, but it's also probably the one that people struggle with the most. Next, we'll be getting into just some general body exams, ears, eyes, mouth exams, plus administering medication, blood draws, and then spay and neuter recovery. So nail trims, this is going to be kind of a main focus on our conversation today, just because it is something that we want our learners to be doing very often. So I know all of our trainers and the staff, we really urge our learners to be getting their nails cut minimally once a month. Most dogs benefit from getting it done about every 2 weeks or so. Once a month is very much the minimum. So if we are letting those nails get longer than they should be, That's just increasing pressure on the nail beds, and this can change the conformation of their paws, their toes, and it just causes some unnatural positioning, which in the long run can be very painful to our learners. It also increases the risk of tearing or breaking the nail. And we always hear a lot of times people go, oh, well, they just will naturally wear their nails down as they're going for walks, as they're playing. But this isn't always true. It kind of depends on the dog's conformation and their gait, whether or not those nails get worn down. And those dew claws, because they're kind of tucked up a little bit higher, they will really never get worn down. So, like I'm going to mention again, it is important that we are cutting our dog's nails at least once a month. One of the things that we like to work on with our dogs is different positionings. So every learner is going to be different in which position they're more comfortable with. I find some good dogs, for their front paws, they rather be sitting and just, handing a paw over, and then you can clip them that way. Some dogs are more comfortable if they're standing. We can do all the paws that way. Some dogs do even better if they're standing up on a table. So those are all things that we want to practice and we can play around with. So
We have a question.
Yes.
Tom and Diane are asking, does the quick grow if you leave the nail long?
Yes, it does. So that is really the main reason that we want to be cutting the nails more frequently, is that as we let that nail grow, that quick gets longer and longer. And then what starts to happen is every time you go to cut the nail, the quick is actually growing longer. So what you're going to have to do is cut the nails even more frequently. So you're going to look at every couple days to get that quick to recede again. A lot of times people see that with rescue dogs that just haven't had their nails clipped at all. That quick is basically down at the end of the nail, and then you just slowly have to work your way back, and it's a long and tedious process. Right. Any other questions? All right, we will go back. And we do have some other knowledge nibbles that go more in depth into nail trims. And I'm sure those are on our YouTube channel. So feel free, if you're looking for some more help, go back and look at those, because they are a lot more thorough than my little presentation will be today. So the very first thing that we need to work on with our learners is basically just the ability to hold their paw. Duration. This is where our duration behavior comes into play. We need to build up to be able to hold that paw, for probably close to 30 seconds to a minute if we're going in and cutting every single nail. So the very first step that we want to do is, can we just hold that foot for 5 seconds? Can the foot be held and we massage each toe? One of the things I do want to mention is that we don't teach our puppies or any of our learners a paw behavior. So just making sure we're going in and kind of scooping that paw up, and making sure it's a comfortable procedure for them. Here's just a little video. This is my pet Mo. So for him, his way of opting in is offering me a paw. He does not like having his feet held, manipulated, cut. So he is one that we have done lots and lots of practice with nail trims. Step 2 is introducing the nail clippers. So again, once we're able to hold that paw, we want to make sure that the dogs understand what these things are that are going to be coming close to them. If we have a dog that is very nervous around nail clippers, some of the things that I'll say to do is just have the nail clippers out around the house. Every time the dog walks by them, they go and interact with them. Yes, and food reward. Again, we want to make those nail clippers a nice and positive. feature to this procedure. So some of the things that we want to look at, that what we can do, uh, can the nail clippers be picked up without the dog moving away? I see a lot of dogs, they're laying there nicely, but as soon as you go and pick up those nail clippers, that dog's like, goodbye, I'm out of here. Can the nail clippers touch the foot? You can leave the paw on the ground, but can those nail clippers just come up and lightly touch the foot? Can the nail clippers touch each individual nail? Can the paw be picked up and held while the nail clippers tap each nail? So again, lots and lots of steps to get our learners comfortable, but the smaller steps that we take, the more positive an outcome you are going to have. So the goal here with cooperative care is that our learner is able to hold that paw still and they're not continuing to pull away. If they're pulling away, that's them saying no. So then we need to let that go, reset the situation, and maybe try again later. Step 3, sound of the nail clippers. So one of the things that we have found is that generally, if you don't have very sharp nail clippers, the noise that it makes can be quite rough for some dogs. So one of the things that we have found to be very helpful is using some uncooked spaghetti to make a similar sound to the nail actually being cut. Um, so basically, what we're looking at with the dogs in their preferred nail trimming stance, so that's either sit down, stand, whatever they're more comfortable with. Can we pick up the foot, hold it? Can we pick up the nail clippers with a piece of spaghetti in it? As you're bringing that nail clipper closer, can you bring the nail clipper down on that piece of spaghetti without your dog flinching and moving away? So this is a great way to kind of practice, especially if you have a dog that's a little bit more sound sensitive. Step 4, once we've gone through all 3 steps, our puppies are nice and comfortable. We can hold their paw. We can tap each of the nails. We can make the noise. Then we need to actually get into cutting the nails. So again, one of the things that I want to mention is that don't feel like you need to get through all of the nails all at once. If you're only able to do one nail at a time, that is fine. If you can do one paw at a time, that is fine. Really, we're looking to make this cooperative. We are looking to make it a positive experience. So go as slow as you need to, so we're not stressing out our learners. So just a few other tips and tricks on how to make nail trims more successful. One of the things that I want to point out is just like humans, our learners have good and bad days. If things are not going well, walk away and try again later. This is something I've had to really focus on with my pet because he definitely has good days and bad days. If I'm not in the right mindset, if he's not in the right mindset, we're just not going to have a very successful training session. So we'll just walk away and try again another day. Having a second handler to offer rewards can also be very helpful, just helps with timing, and you can reward them a lot quicker than if you were doing it yourself. What we are looking for is to be rewarding the dog for being cooperative. If the dog is not cooperating, we can just let them walk away without a food reward, and then we're going to reset the situation. We're going to take it a few steps back, make it a little bit easier for them so that they can be successful. If the dog moves away, you can just sit and wait for them to re-engage. If they come back, great. You want to start probably at a step earlier. If they don't come back, that's okay. We'll just start the training session at a different time. Test out different positions. Like I said, all dogs have different positions that they prefer to get their nails trimmed in. So find the one that your learner is most successful at. And then lastly, make sure your nail clippers are sharp. If they're not sharp, they're going to be squishing that nail, and that's going to be a lot more sensitive to our dogs. So making sure they're sharp. I don't actually know if there's a way to sharpen nail clippers. I generally just go and buy a new pair. after I've had them for a while. And then lastly, on our topic of nails, please utilize the NSD nail nights. These are for our volunteers. I know nails are a very tricky thing, especially when you have very young dogs that tend not to be super cooperative. So please utilize these, but you still need to be practicing in between visits. Like we talked about with cooperative care, practice makes perfect. The more you practice, the easier these procedures are going to be for our learners and for the humans that are having to actually do the procedure. And if you're unable to make the nail night, feel free to reach out to any staff and see if you can come in another time. We're generally pretty flexible, especially during the day, but there are classes at night, and you could probably come a couple minutes early to get them done. Just a reminder, at the Education Center on King Street, nail nights are the first Thursday of every month. At Cedar Creek in Cambridge, they are the third Tuesday of every month. I'm just going to exit and see if anybody has any questions before we move on.
I think you got most of them, but I was gonna throw in, even if your learner is comfortable with nail trims and you're comfortable cutting their nails, remember they're not gonna be with you their entire life. And they might be having their nails trimmed by another volunteer, a client, a groomer, a vet tech, any of those. So it's good to have them practice with other people too. I think a lot of our recent friends have come to nail night and been very uncomfortable, but generally we're fine at home. So make sure you utilize that as a resource for practicing with different people as well.
Very good point, Emma. All right, moving on. Next, we're going to talk about general body exams. So for this, the goal is that the learner can remain in a sit, down, or stand while they are getting examined. Again, whatever position your learner is most comfortable in, whoever is doing the exam, they can work with that. Remember, less is more. You always want to try to end the training session before the learner wants to say no. So if we're looking at doing just a general body exam, feel free to break it up into multiple sessions. So you can look at the front end, you can look at the back end, or you can look at one leg and the other leg. Don't feel like you need to do everything all at once. Just like we talk about, small slices are much better than one large pizza. So making sure that we're breaking up training sessions to keep it nice and positive. When we're looking at a general body exam, steps for success. So first off, we need to build up some duration. So whether that be a sit, down, or stand, you want to be able to work up to about 20 seconds. Can they just hold that position for 20 seconds? Step 2, while holding that position, can we go and touch individual body parts? So you're just going to do a quick touch of the shoulder. Yes, food word, and release. Again, we'll just one thing at a time. Then you're going to start increasing the duration of the touching. So can you touch the shoulder and massage it for 5 seconds? We just are looking at building duration again. Step 4, can you increase the number of body parts that you're able to touch? So can you go and touch the shoulder? Then can you touch the paw? Can you touch their belly? So everything that we do is building on top of it before we're allowing the dog to be released. So when we're looking at general body exams, things that we would utilize this for. So obviously during vet exams, every time our learners see our vet, they get kind of a whole body check over just to make sure there's nothing outstanding that we need to follow up with. The other thing that I really like this for is, especially in the warmer weather, like just after this weekend that we have, is tick checks. Ticks can be absolutely anywhere. They can be in the ears, they can be in the armpits, groins, mouth. Uh, I always find them around my dog's collar. So this is another really positive way to work on a general body exam, is getting our learners to sit down, stand, and we're just going to run our hands all around their body, checking for um, those nasty little ticks that I know have been out and about this weekend. Here's again my friend Mo working on some body handling. And you can see as um, Mo's he's an old man now, but he knows a stand behavior, so he'll just stand and wait there. But it does come in very handy because I can do a full body check. Checking the hips like I'm doing here, this is something that most vets will do on every single vet visit, and a lot of dogs find it quite uncomfortable because they're having to balance on 3 legs, so I always like to practice that with my learners. Any questions on general body exams? No? All right. We're going to move on to ears, eyes, and mouth. So, again, I like to break this down. I generally won't do a full body exam and a head exam all at once. We want to make sure that we are giving our learners a little bit of a break. So, the goal with this is that the learners can rest their chin in your hand and allow for the ears, eyes, and mouth to be examined. Uh, a lot of our learners don't learn a chin cue until much older. Don't worry about that. You can just go ahead and just cup your learner's chin in your hand, and we're just going to build duration that way. I'll just show you a little video before we talk about the steps. This is probably one of my favorite cooperative cares. Um, I should have actually done a video where I don't have Molson resting his chin because there was no way he would allow me to look in his ears, eyes, or mouth. If I don't have that chin behavior, his head is just every which way. So this is something that we have practiced a lot. Knock on wood, he hasn't had to have a lot of medication, but if we ever had to administer medication, this is a very handy behavior to have. So working on steps for success. So step one, practice cupping the learner's chin. Again, we are just looking to build up some duration. If we can get up to about 20 seconds, that's kind of the perfect amount of time. Step two, while holding the position, are you able to touch individual head parts? So can you just gently touch the ear? If your learner doesn't move, yes, food reward, give them a little bit of a break. Then you're going to reset. Can you touch the other ear? If they don't move, yes, food reward, and let them walk away. Step three, we're going to increase the duration of touching the individual head parts. So, can we rest their chin? Can we touch their ear? Count to 3. And then you're going to slowly increase the duration. Again, if we ever have to give medication, you're probably looking at needing to touch those individual head parts anywhere from kind of 10 to 15 seconds in order to administer that medication. Step 4, can you increase the number of head parts you touch in the same session? So, like I did here with Molson, this is just kind of a general ear, eyes, and mouth exam. So, we've worked up to him allowing me to look in both his ears, to look in both his eyes and his mouth all in one training session. And with the eyes, it is also very important that you work on kind of opening that eye nice and wide. For anyone that has ever administered eye medication, you do really need to kind of hold that eye open in order to get the drops in. Eo's eyes, administering medication. What is the goal? The learner can rest their chin in your hand and allow medication to be administered. Much easier said than done. A lot of dogs are okay with the handling, but then once they see something approaching their face, so whether that's ear meds, eyes meds, that's when they kind of leave the situation. Some of the things that we want to do before this happens. So train before medications are required. This is my number one training tip. Practice all these things before you actually have to give ear or eye medications. It'll make everybody's life so much easier. Um, we really want the learners to have a good foundation of cupping the chin and holding for about 15 to 20 seconds before we start working on pretending to administer medication. Uh, this is just because we need them to stay still, basically. We can't have them flailing around. Um, and then learners also need to be comfortable with having their ear flaps held open and, like I mentioned before, holding their eyes open. So, what are the steps for success? Step one, while holding position, you want to pick up a small bottle. It can really be anything. If you don't have a bottle, it could even be a pen. It just needs to be something small that you're going to bring towards the dog's face. Um, and yeah, you're going to bring it towards their face. If they don't move, yes, and reward, and then you can release them. Each time you're going to bring the bottle closer, as long as they're not moving, yes, and food reward. Step three, you're going to walk up to actually pretending to administer the meds. One of the things that I like to use for ear meds is actually just like an empty squirt bottle, and it'll blow a little bit of air into the ear. Don't do this with the eyes because it can cause an eye infection. But with the ears, if you just squeeze it, it'll give a little puff of air. That'll be kind of similar to what will happen if they actually get ear meds in their ear. And this is something that I don't practice very often with Mo. I know I just said I should be, so this is obviously an area that we need to work on a little bit more. So in the beginning, he was flinching a bit more than I expected him to. So in this video, I'm just kind of warming him up, just kind of getting him used to the meds coming. You can see his eyes. He's like, "What is that coming to my head?" And then if you can there, you just wanna add a little bit of duration. I know for me, one of the most frustrating things is trying to get the eye meds actually into the dog's eye. So if you can get that eyedropper and them not moving for about 3 seconds, that gives you a good amount of time to get that drop, hopefully in their eye and not miss. Any questions? No? Alright. Blood draws. So we're gonna go over this very quickly, as I know there was just a bunch of information sent out, um, because it is 40X testing season. All of our learners will be needing to go in for just a simple blood test. But this is something that they will need to do at least once every single year. So it's something that we want to make sure that we are practicing with our learners. So what is the goal? The goal is that the learners can be restrained for a simple blood draw, reminders for success, practice restraints in various different environments. So just like Emma mentioned with nail trims, with blood draws, it will not be in your kitchen. It will not be with you. So making sure you're practicing in different environments. Do it at the mall, do it at the office, do it outside, do it in different parts of your house. Secondly, again, like Emma mentioned, we want to have different people practicing the restraint. When your learners come into NSD, it'll probably be myself holding the dogs while they're getting their blood drawn. So we want to make sure that they're comfortable having other people doing the restraining. And then lastly, test out different positions. So we can get blood from any position. If the dog is sitting, standing, laying down. We're pretty flexible. So if you just walk on one way and you let us know when your dog comes in, we've been practicing from a laying down or from standing. We are more than happy to do that with the learner. So here's just a quick little video of Mo. One of my other suggestions is do not do it on a slippery floor because, as you can see, most poor feet are slipping away. He's struggling to um, keep himself up. So please do it not on a slippery floor. So that's just the restraint in the handout that went out to everybody. There is working on adding a tourniquet. So that is more for if there's not a second handler, putting that on and we can get blood that way. And then actually going ahead and with the needle. So making sure that you guys are looking at those documents and just preparing your learners as best you can.
If you have a very excitable or wiggly learner, laying down might be the most successful for them because there will be people moving towards them, like the vet. So sometimes if they love to greet everyone, laying down adds that extra layer of impulse control.
Yes, whatever is best for your learner, and they will be getting lots of food rewards that day. So we do try and keep it as positive as possible. Spay and neuter recovery. So this is again something that we can work on some of the procedures to make it a little bit more comfortable for our learners. So what are some things we can do to set them up for success? So we can start practicing wearing a hard or soft cone for an extended period of time. One of the most important things, if your learner is not going to be wearing a hard cone, which is pictured on Austin, they're going to be wearing a soft cone. You do need to make sure that they are not able to reach their incision site, as sometimes those soft cones, our dogs are just able to get around them. I do also know that some people like to put on the recovery onesies. My big note with those is making sure that they're not on all the time, as we do want to make sure that we are getting airflow to the incision sites. Those onesies can just kind of harbor some moisture, and that's not going to be good for the incision. You also want to make sure that your dog is not going to chew the area still, because there's nothing preventing them from kind of nibbling at the area. We want to practice going out on leash for bathroom breaks. I know as some of our learners get older, they can get a little bit particular about how they go to the bathroom. Some dogs are like, I can only go in my backyard by myself. But we want to make sure that they are comfortable going on leash to the bathroom. And then lastly, just making sure that we are building up to spending some more time leashed, tethered, crated in an X pen. Recovery is generally 10 to 14 days, where there is a big part of restricted activity. So we want to make sure that our learners have been prepared for that. Um, and I am just going to mention, if anyone has a learner coming up that is going to be spayed or neutered soon and they want to start practicing with a hard cone, please just reach out to myself or Paula, and we have lots of spare cones, so you guys can take one home and start practicing to get the learners more comfortable wearing it. Is not when they actually get spayed or neutered and they're already very unhappy. Any questions about spays and neuters? No. So that kind of ends the topics for today, but I do want to just kind of go over what are the goals of cooperative care. So really the idea is that we are building a positive relationship to husbandry procedures to make it less stressful for the learner and ourselves. You know, the more calm and composed the learner is going to be, the easier it is for us to do all the husbandry procedures that we need to do. Start practicing before the procedure is required. Like I mentioned, before your dog actually needs your eye meds, let's practice so we can make sure that they are somewhat comfortable with the procedures. My other big tip is continue to offer practice sessions to positively outweigh the actual procedures. There are going to be procedures that no matter what, your learner is just not going to be comfortable with. So we want to make sure that we are continuing to practice basically make up for it. So always continue to practice. Practice is going to be your number one reason that your dog is going to be successful. Uh, and then lastly, just the opportunities for cooperative care are endless. It's really just taking the time to teach our learners, which I know can be a little bit difficult, just finding the time. But if you put the time in the front end, it's going to be a lot easier down the road. Um, I do just have a link in here. You guys can go look at it. It's the IAABC Foundation. They have a good page on cooperative care, and they have some videos of there's a dog doing cooperative care, a horse, and I think it's like a parrot. But there's all kinds of cool videos of different animals doing cooperative care. And I always think about it, if you can get a lion to hold their paw out for a blood draw, we should be able to get our dogs to do absolutely anything for us. And that wraps up. If anyone has any questions, feel free to ask away. This little puppy is Moose. He was the first NSD puppy I took home for a couple days. Any questions?
Martha was wondering at what age are the dogs spayed or neutered?
So generally it's around a year old. So with our females, I say this is we generally let them go through at least one heat cycle. Um, if they hit, 14, 15 months and we're not looking at them for breeding, we'll just go ahead and spay them. With our males, usually once they hit a year old, we'll go ahead and neuter them. Again, if we're looking at them for breeding, it can be a little bit later, but the goal is around a year old.